I'm Kate Dillon. I'm one of the organizers here at the Hickory Women's Expo. And our next speaker is Dr. Diana Williams. She is the owner of Strategic Wellness here in Hickory, and she is a highly accomplished family nurse practitioner with a distinguished background in nursing and functional medicine. And I think that's so key these days. You know, medicine has taken a turn in a lot of ways, and functional medicine, in my opinion, is one of the best ways out there. She holds a Doctorate of Nursing Practice from Duke University, a Master of Science in Nursing from Western Carolina, and a Bachelor of Science in Nursing from Lenoir Rhyne University. And additionally, she earned a Bachelor of Science in Biology from North Greenville University. And still, you look so young. It's we might need to have some anti-aging secrets from Dr. Diana. Yeah, it's the anti-aging. So I know she does that too, but today we're going to learn a little bit more about the brain-ovarian connection, and I'm going to adjust a little bit of this microphone here, but let's welcome Dr. Diana Williams.
Thank you, Kate. So appreciative to be here. I love women. I love talking about women's health and women's hormones. It is my life's call. My mission in life is to help women feel and look and do their best. So we're going to talk today about the brain-ovarian connection. We're going to be talking more about mood, cognition, and how to improve overall mental energy, mental function, and cognitive function as well. So have you ever heard of like a weird connection? Like maybe it's a very odd couple that just doesn't look like they go together. Like a husband and wife, businessman, and wife's a hippie, and they just don't look like they go together, right? It's like the Kim Kardashian and, well, just about any of her recent boyfriends, right? They just don't seem like a fit. Or maybe a food, like a friend or family member eats something super weird. Like that doesn't go together. So my grandmother used to love Duke's mayonnaise and banana sandwiches. I'd never heard that before, but watching her eat, I just thought, same. Apparently it's a thing. I didn't realize this, but it just sounds so weird that these two things could be connected. I kind of think the same thing when I first went into practice in medicine was the brain-ovarian connection, right? So two completely different organs, two completely different hormone-producing glands. You would think that never really talk to each other, but they're so important. And it's really going to be an area of my specific interest since I started doing my research project at Duke University, really understanding how our hormones, particularly those that are produced by the ovaries, are affecting our brain function. So that's energy, mood, all the things. So we're going to go in and talk about that for better outcomes for women because we're all going to be influenced by this to some degree. So I am Diana Williams. I am owner, founder of Strategic Wellness Center that is a functional anti-aging practice here in Hickory, North Carolina. We also have a satellite campus in Statesville. We've been established for about 6 years. I also teach other providers, doctors, PAs, nurse practitioners on how to prescribe safely BHRT. I'm a mom of 3 girls and a wife. They're all in Blowing Rock right now having fun without me, so they're going to see some lots of good pictures. Obviously, I've got my doctorate in nursing. I have a lot of degrees, right? I am a career student. I absolutely love learning. I probably will eventually go back and get a postdoc at some degree. I just love doing learning, and I can't get enough of it. But with Duke University, that platform allowed me to really thoroughly dive more into the research between the brain-ovarian axis. I had a lot of access to really good, smart, intelligent people and really good resources to help me better understand this. So this is where my area of expertise in, specifically for premenopausal women dealing from severe PMS and PMDD. That is severely on the rise. PMDD specifically affects the gut, brain, and ovarian axis, and this debilitating disease affects about 8% of women of reproductive age, and it can lead to suicidality. So no one's talking about it. There's very limited options in treatment out there. So this is why I do what I do. But I wasn't always healthy. I was actually very unhealthy. This was kind of 8 years ago, roughly, after the birth of my second daughter, I was riddled with autoimmunity. I look fairly healthy today. I look fairly young and fairly healthy, but that's through a lot of work in trying to heal my body. I was absolutely debilitated. I was having all the physical symptoms that you can think of, right? My skin was completely just falling off. I was basically unable to work, but those were just the physical symptoms. The silent symptoms like the mood issues, the panic attacks, the depression, the anxiety, the brain fog, weight changes, mood, irritability. I just feel like there was a foreign person in my body. I did not feel like myself. So what I did was found through several aspects of medicine, I found functional medicine, right? Functional medicine addresses the root cause. We'll talk about a little bit more into that, but I was able to heal my body, my skin, my brain, my gut, all the things through these functional medicine practices. That's why I started my clinic, to help other people, because I truly believe that a lot of these conditions are lifestyle based, and if we can be aware of how we're impacting our bodies through food and stress and exercise, then we can certainly improve outcomes long term. So the brain-ovarian connection, we know that these can contain a lot of different symptoms. So signs and symptoms usually happen before a disease process actually sets in, before you actually get a diagnosis. So the body's been crying for help for a long, long time, sometimes years, sometimes decades before a diagnosis is finally met. This is very common with women with autoimmunity, specifically like Hashimoto's, which is an autoimmune process in the thyroid gland. You can have symptoms for up to 10 years to actually get a diagnosis, unfortunately. So the symptoms start first. Typical symptoms that affect the brain-ovarian axis are mood swings, right? So not just the premenopausal, perimenopausal mood swings, but even after menopause, you can just get super irritable for no reason, like you just have a very short fuse with your friends and family. Cognitive issues, so these are things like recall and brain fog. When I see my clients, I ask them what the top 3 things is that they want to improve, and I'm telling you, one of those issues is usually brain fog. So it's just this debilitating. I can't think of why I went to the grocery store. I feel like I'm getting early onset dementia. Like, I hear these women saying this all this time, and it can be treated. It is a structural, it's a functional issue that's going to eventually can be treated through functional medicine. Sleep disturbances, if you're seeing some issues with like your sleep quality or quantity changing, that could be an issue with the brain-ovarian axis, as well as physical inflammatory symptoms like headaches, migraines. Those are very much caused by hormonal fluctuations in the body. These are the conditions, right? So we talked about the symptoms. If those symptoms go undiagnosed and untreated, then eventually it can go on and perform a true diagnosis. So these are the 4 most common ovarian hormone-related brain conditions that we're seeing in America. And unfortunately, they are significantly more disproportionately affecting female over male. So why, right? We need to ask the question of why are women getting sicker, more dementia, more autoimmunity, more strokes, more Alzheimer's disease, more depression than men, and we're usually more severe. And there usually is an answer, and that answer, at least to some degree, is hormones. So that's what we're going to do to kind of dive a little bit deeper into that. But you can see here the statistics for depression. Approximately 1 in 8 women will experience depression at some point in their life. Usually it's going to happen during those hormonal fluctuation changes. So postpartum depression, premenstrual syndromes, and then through that menopause picture, you can see some of these issues. Alzheimer's disease is just one component of cognitive issues, cognitive types of dementia in America. It affects 4 million women, and those statistics are climbing astronomically, guys. So a significantly amount of us are going to be affected by Alzheimer's, and probably most of us know someone affected by Alzheimer's. My grandmother, that is the bananas, and Duke's mayonnaise sandwiches, she passed from Alzheimer's 2 years ago. So it is affecting me personally. So this is something that I want to be preventative and very productive in terms of like changing my outcomes based on the things I'm doing to my body now. So we all have about 20% risk of developing Alzheimer's disease at some point in our life, and that number is increasing. So about 1/4 of us essentially are going to develop Alzheimer's, which is very alarming statistics. It's also the 6th leading cause of death for women. Stroke is huge. So stroke is a cerebrovascular issue. So it is kind of in the same component of heart disease. So we call it cerebrovascular disease that can affect the brain, or cardiovascular disease that can affect the brain or the heart. And basically the stroke is the heart attack of the brain, if you will. We are significantly more at risk for stroke than men, and about 60% of all strokes happen in women. MS. MS is one of the most common autoimmune process that affects the brain. You'd be hard-pressed to know someone. 20 years ago, it was really hard to meet somebody with MS, and now it's very, very common. There's celebrities being diagnosed with it. So MS is an autoimmune process actually affecting what's happening with the brain tissue. And of course, like all autoimmune conditions, women are more likely to develop this. So what's happening? Why are we more at risk? So traditional medicine, conventional therapies, it's a pill for everything. every ill, right? You go in and you have this symptom of brain fog, and they may give you a stimulant, or they may, tell you to sleep more, or whatever the case may be. Or you have something like an autoimmune process, so they give you an immunomodulator to suppress your immune system. Or if you have a risk for strokes, they're going to give you a cholesterol lowering medication. None of that is treating the root cause, right? None of that, they're all Band-Aid approaches, right? And they're helpful. We're glad that they exist, and I certainly will utilize some of these if necessary, but none of it's treating the root cause, and that's what we need to be doing. And then, of course, if they can't help us, then they refer us. So what I see is women to come into me, that they have 3, 4, 5 different specialists that are involved in their care, and nobody can give them answers as to why. They can just tell them what they're going to do to treat it, which is usually medications and diagnoses. And then, unfortunately, there's self-medication. Like, these women are desperate. The depression, the anxiety, the fear factor of I'm losing my mind is very intense. So we start to self-medicate, right? We got to numb whatever we can, or alcohol, drugs, and even other addictions. Social media is an addiction. We've got all kind of things that are at our fingertips now. Anything that we can do to just numb ourselves from the fear of what's to come, if you will. So functional medicine is different. We're not a pill for every ill. We're not treating symptoms. We are truly treating the underlying root causes of why these things are happening in the body to begin with. So it's the answer of why, not what. And it does require some, advanced testing and treatment and really good quality time with their clients. I spent over an hour with my new clients just understanding, how they got to the place that they're in. That's very hard to do in a traditional medicine setting where you have an 8-minute office appointment. In the conventional, to support them or defend them in some ways, like every doctor would love to spend an hour with their clients, right? Like, they don't go into healthcare just to make a buck. You do it because you want to help people, right? It's the insurance-based model that it forces them to see this many patients. So they just can't afford to keep the doors open if they don't. So it's not, in defense of them, it's not because they don't want to spend time with you. It's just that they can't because the insurance-based model doesn't afford that luxury. So obviously, we've already kind of told you the answer, right? What is the underlying root cause of why women are more predisposed to having cognitive issues, headaches, brain fog, strokes, those kind of things? And it's hormones. Hormones are our life line. They are keeping us young. They are keeping us healthy. And we have several parts of our lives, from puberty, fertility, perimenopause, postmenopause, where we have severe fluctuations of these hormones. And this is when we start to see these disease processes starting. Autoimmunity, specifically Hashimoto's, is where the research is, but there are probably a lot of other ones too, usually happens after the birth of children. And that's when mine started. My autoimmune process actually was caught and diagnosed, but my symptoms started after the birth of my second child. And it was the pregnancy that triggered it. So all these fluctuations in hormones that are supposed to be immunomodulators to kind of keep us healthy, supporting our immune system. But if they're up and down, that's when the trouble starts to set in. So the ovaries are predominantly the hormone, the gland that produces these hormones: estrogen, progesterone, testosterone, DHEA. They're produced predominantly by the ovaries if they're young and healthy. Now, obviously, after menopause, we produce significantly less of these hormones because ovaries weren't working anymore. They're shriveled up, they don't work. But your body's not supposed to stop producing these things, despite what you've been told. You're never supposed to stop making your estrogen, your progesterone, your testosterone. You just don't produce them at the huge high amounts that you did when you were trying to promote fertility. So somebody else has got to produce it, right? So it's typically the adrenal glands or the gut that comes in and makes these hormones after menopause. Granted, that requires a healthy adrenal gland and a healthy gut to go into menopause. Oh, just for specifics, as far as like what their role is, I think actually the next slide is going to show that. So there are benefits of estrogen, right? So we know estrogen stops hot flashes. We know estrogen helps with our sex drive. We know estrogen keeps our skin nice and healthy and our hair nice and flowy. But there are other things that actually help not just produce better symptoms, but actually decrease your risk of chronic conditions that estrogen does that no one's talking about. Estrogen decreases your risk of getting Alzheimer's disease. Estrogen decreases your risk of getting osteoporosis and bone loss, which is a bigger killer for women than breast cancer. No one's talking about these things. Estrogen is a huge, huge beneficial hormone. If you want to stay young and healthy, you need your estrogen. It also helps regulate our mood. It protects the actual structures of our brain from actual shrinkage. Testosterone does something similar as well. And of course, we do see a decreased risk of cardiovascular and heart disease as well. We see all these women dying of heart attacks shortly after menopause because their estrogen level tanks, and estrogen actually protects the structural integrity of the vessels. So the arteries and the blood supply, it gets stiff without estrogen. Estrogen keeps it nice and pliable and movable because the stiffness of the arteries is what's killing us. So testosterone's our vitality hormone. It's our young, voracious, like va-va-voom hormone, if you will, if you get what I'm saying. Like it helps, with that libido, that sex drive, which is so important for women. I actually had a client come to me the other day, and she was telling her OBGYN, she was postmenopausal, and she was like, I've got no sex drive at all, and it is in the toilet, it tanked. And the gynecologist says to her, well, you're not trying to have babies anymore, you don't need a sex drive. That is incorrect. There are medical benefits to having intercourse on multiple levels, and it does matter for our mental health, for our physical health. So this is something that should be talked about more, and I know I'm embarrassing everybody, and this is what I do. I talk about poop and sex all day long, so I love it. I don't get embarrassed at all. But yes, it does need to be talked about more. So testosterone does help with that va-va-voom, right? But it also helps improve, again, the structural integrity of the brain, the muscles, the bones. We see so many women going through menopause that start putting on a whole bunch of weight gain. Some of that's because their testosterone levels are in the toilet. Testosterone helps build muscles and bone. So if you're working out, you're exercising, you're still not seeing the muscle benefit, it could be from a low testosterone. And yes, women need testosterone as well. Progesterone is the modulator in the play box. So you've got your estrogen that's super energizing. She's super fun. She's like the party girl, right? Testosterone's that like, hey, let's get funky, right? Let's have a good time. And the progesterone just calms everybody down, right? She's the modulator in the play box that says, guys, it's time to go to sleep now. It's time to relax. We can't have fun all day long. It's time to calm down. So it's just your natural Xanax, if you will, and that's true. Progesterone works on the GABA receptors in the brain, which is a natural Xanax. It calms us down. It lets us sleep. It helps us relax. So that's why progesterone is so important, specifically for the brain, because there are receptors in the brain for progesterone. Another thing is we tell women that don't have a uterus anymore. We take their uterus out and we put them on estrogen, and we forget to put them on progesterone, thinking, well, you don't really need progesterone because its only job is to protect the uterus from uterine cancer. That is not true. There are progesterone receptors all over the body, and especially in the brain. That's why progesterone balancing needs to happen at all stages of our life. So again, root cause, right? We're functional medicine. We're not here just to give a whole bunch of hormones to a whole bunch of people, right? I love hormone replacement therapy, but you do not want to put hormones in an inflamed, toxic environment. We want to address the root cause. Why are the hormones imbalanced in the first place? Those are what we're going to try to do. These are your common ones. There's 2 pages of these, by the way, that we address with every single patient that we have. I'm not sure why there's a lamb representing menopause. I think I meant back to change that. I'm not sure what that's about, but he's cute nonetheless. Stress is a big one. Stress is a big one that's going to cause disruption in our hormones because the brain talks to the ovaries, but the brain also talks to the adrenal glands, which talk to the ovaries, which talk to the thyroid, which talk to everything else, right? All these hormones are interconnected. They talk to each other. So we don't want to isolate one without addressing all of them, essentially. So for instance, if we're really, really stressed out, psychological stressors like we're having babies and trying to work full time and trying to build a career, and then oh, by the way, we now have autoimmunity as well. What's happening is the body is actually trying to make all this cortisol just to keep you alive because of all the stress that you're under. It's got to come from something. Cortisol is manufactured from the same enzymes that make your progesterone that calms you down. So if you're really wired but yet fatigued and tired, it could be a symptom of an HPA axis disruption, and this is what's happening. Your body's taking your hormones, estrogen, progesterone, testosterone, to make more cortisol. Stress management is a huge piece, especially through that perimenopausal period. Menopause, obviously, right? It's an ovarian failure, but again, we just talked about you're still supposed to have hormones after menopause. You're not supposed to stop making them altogether. Other conditions that affect the ovaries themselves, like a PCOS type picture, ovarian cysts, even endometriosis can all affect this as well. Thyroid dysfunction. Remember, we don't want to just isolate and treat just the estrogen, progesterone. We want to address the thyroid as well. Gut health. Gut health is huge, and yes, I'm sure all of you have heard about the gut-brain connection, right? So I'm just going to throw a little extra in there and say the gut-ovarian connection. We need to be talking about that as well. But really, you can't really talk about the gut-ovarian connection without at least addressing the gut health. The gut makes some of your hormones, but it also helps you get rid of your hormones after they've been utilized, so it does matter. Anything that's going to cause inflammation in the body. So inflammation is swelling. It can block the receptors. So hormones are basically like a lock and key. So hormones are all these wonderful keys. They go and turn on your metabolism. They turn on your brain health. They help support everything, right? It's got to fit into something. It fits into a lock. Those locks are called receptors. If there's swelling in the body secondary to toxins in our systems, nutritional insufficiencies, not having enough B vitamins or omega-3 fatty acids to counteract that inflammation, then that inflammation will actually block the receptors. You can make all the wonderful hormones in the world, but if they can't get to the receptor because there's inflammation, you're never going to feel better. So that's why it's important to look at all these pictures to try to get your brain to function better. So yes, the brain-ovarian connection, I'm talking again about the gut-brain axis. The gut makes the hormones, the gut talks to the brain, and the gut is basically the gateway of how inflammation gets into our system. So all of us going through any hormonal change, or we're already postmenopausal and we don't have the change anymore, we still need to make sure that we're addressing gut health. Several different ways. I'm not going to spend a lot of time with there, but I just would be remiss if I didn't talk about this, the importance of the gut-brain axis. So the gut and the brain, they communicate, right? So whatever's happening in the gut is going to affect the brain. And then to make sure we're going to have a good, healthy microbiome. That's the bacteria in our gut that also affect our mood. There's so much research. I was just looking at my phone. There's an article came out not too long ago. They're saying OCD, obsessive compulsive behaviors, are due to a bacteria in the gut that's affecting the brain. We know all these things have to be addressed. It's what's happening in the gut's going to affect our brain. So there's a lot of different components to that. It's not usually one thing, one trigger that offset the apple cart. It's the straw that broke the camel's back. So everything needs to be addressed kind of holistically. Again, the gut-brain inflammation axis, and then we're talking about the neurotransmitters. A lot of our serotonin is not an ovarian hormone, I give you that, but 80 to 90% of the serotonin that we're taking antidepressants for, so those SSRIs, the Prozac, the citalopram, the Lexapro, those medications are basically allowing serotonin, which is your calming hormone, to allow them to circulate longer so your body doesn't degrade and get rid of them faster. It's not making any more serotonin, so it's not fixing the problem. That's why every 6 months to a year, you got to go in and get a dose increase, or the medication stops working, you got to get a new medication, because no one addressed the root cause to begin with. You're not making any serotonin. So the serotonin is manufactured in the gut by certain bacteria. If you're not addressing that, then that's why the medications aren't working as good as they should. So how can we improve gut health? By the way, if we're going to improve gut health, we're also going to improve outcomes for our brain, right? That's what we're all talking about. You can't just improve brain health without addressing the gut health. So the way you do that is by eating really good food. If we're overeating or eating too much of this processed food, so processed foods, a lot of our grains, if it's not naturally derived, like a fruit or a vegetable or a plant-based something, then it most likely is a processed food. Now, there's highly processed, like the ice cream that you buy in the store that doesn't melt anymore. That's kind of scary. Y'all seen that? Like, we're talking about that on Instagram right now. Like the ice cream sandwiches, you put it out in the 90-degree weather and it doesn't melt for days. Like, that's weird. Like, ice cream's supposed to melt. That's what they're doing to our food supply. Right? We need to be aware of that. And eating one of those ice cream sandwiches is not going to kill you, right? But a buildup of that, eating those multiple times a day or multiple times a week for 40, 50, 60 years, yeah, that's going to have an impact on us. So reduce the processed food, eating more whole foods, fruits, vegetables, animal products, beans, lentils, things that were naturally found in nature, the produce section, so not going in the aisles and getting chips and cookies and all this stuff. That's all processed. If it comes in a bag with a label on it, you can assume it's probably a processed food. Stay hydrated. The gut, we're like 90% water, so if you're dehydrated, it's going to affect everything, including your gut. Sometimes supplements help, right? We do a lot of supplementation in our office, and these have been shown in literature to improve outcomes with the gut-brain axis. So things like digestive enzymes and L-glutamine, zinc, and probiotics, and then fiber are all helping support the microbiome. So those little happy bugs in your gut start making their own hormones again. Stress management. We already talked about stress management causing the issue with the gut-brain axis and the brain-ovarian axis. So what can you do to manage stress? Anything. Pick one. Pick them all. Like, just do something, right? Like, if we're not doing anything proactively to help support our stress in our body, pick one that works for you, like exercise. And we're talking about gentle exercise, right? You can overdo something and then still cause more issues on your body. Stress-based mindfulness. We have some fantastic exhibitors out here that have brought some amazing tools. I love a facial. I love a good massage. Go to the chiropractor. There's a salt therapy place out there. That's amazing. Like, so many amazing brands and people really truly believing and like helping you find that state of relaxation in whichever way, or you can do it for free. You can just get an app on your phone or listen to music and just get in a quiet spot. But you do need to be practicing this every day. When I was doing my research with Duke University, we were showing that mindfulness-based strategies, so yoga, meditation, prayer, journaling, whatever that is, you need to practice it for 30 minutes a day, 5 days a week. So this is almost a daily practice. It's like, oh, I went to yoga last Tuesday. I don't feel any better. No, we're not. It doesn't work that way. Needs to be a habit. It needs to be a practice thing. Obviously, eating good, sleeping good, making sure you're sleeping. We can't expect to be on our phones till midnight and getting up at 6 o'clock in the morning and think our brain's going to function normally. We have to make sure that we're giving it the tools that it needs. So reducing chemicals, again, the chemicals are found everywhere. They're in our drink supply. They're in our personal care items. The average woman before she leaves her house in the morning is exposed to 150 different toxic chemicals, guys. This is ridiculous. We cannot wait on the government to protect us from our chemicals. So just assume because it's sold on the shelf, it doesn't mean it's safe. Just because it has a FDA approval doesn't mean it's safe. So you have to be self-educated. You have to use natural products. It's a build-up effect, right? Like if you choose like this really good skincare, like took all the wrinkles off my face, that's amazing, right? But just know that that's probably not a natural thing. That's not a natural process, right? So be choosy. Choose which products you're going to use, but also just educate yourself that an accumulation of all these toxins can eventually cause some issues. Filter your water. That's a very easy way to reduce a ton of toxic chemicals. By the way, if you really want to scare yourself, look up the Hickory City water supply and look at their rating. It's all online. They rate it from 0 to 10 to be the most toxic. Hickory's 9 out of 10. There's chloroform in our water source. Yeah, it's pretty scary. But it's on national average. The national average is 9 out of 10, and that's an acceptable, it's not that Hickory's any more toxic than anybody else. It's just that's the natural acceptable rate. As long as it's not 11, they're okay with it. So get a Berkey filtration system, get a whole house filtration. These are, you can pay $250 and getting a countertop filter that lasts a year, and I purchased that. So most of your water that you need to be drinking needs to be filtered. So obviously, yes, once you manage your stress and detoxify and support your gut health, I know it sounds like a laundry list of things I just threw at you to do, and now you got to have all this homework, right? That's not my intention. My intention is to educate and inform that these things do affect you. We can also utilize other tools, so bioidentical hormone replacement therapy. If you're not making enough estrogen, progesterone, testosterone, we can give it back to you to hopefully improve outcomes and decrease your risk of some of these conditions that we just talked about. But again, you don't want to put hormones in an inflamed, toxic environment. That's why you want to make sure that you're doing it holistically and comprehensively. But you can certainly reduce outcomes. We've seen a 50% lower chance of developing Alzheimer's disease for people who are on estrogen replacement therapy, which is pretty phenomenal. All right, so just takeaways, right? Just a recap. Optimize your nutrition. Eat whole foods. Eat clean foods. Try to get lowest processed foods as you can. Manage your stress. Move your body. Making sure you're getting 7 hours of quality sleep a night. Prioritize your gut health through fiber and clean drinking water. Try to be aware of toxins and avoid the big ones that we just talked about. And then, of course, if you're a candidate, you can consider hormone replacement therapy. I don't know how much time I have. Catherine, are you after me? I got a little bit of time. I'll take some questions if you have any questions in regards to whatever, brain ovarian axis, hormones, whatever. Yes, ma'am.
So I have a history in my family, not personally, of hormone-related cancers. But I could benefit from hormone replacement therapy. Do you have any suggestions about that? Because
Sure. I get that question all the time.
I tend to not want me to do that.
So 80% of cancers are environmental. They're not genetic. So if you're just avoiding the potential outcomes of decreasing your risk of Alzheimer's, osteoporosis, which we just talked about, carries a greater risk of killing you than breast cancer, and you're avoiding estrogen replacement therapy, you can potentially increase your risk of depression, anxiety, then we're not doing you any service. So I would say you don't want to, that's why we don't put hormones in an inflamed environment, right? I firmly believe that estrogen doesn't cause breast cancer. Based on the research that we have now, there was a new study that came out that actually looked at all the research that has been telling us for 20 years that estrogen causes breast cancer. It's a false. It's actually a myth. And in fact, we're seeing a 24% reduction of breast cancer with estrogen replacement therapy. So the research has been wrong. We've been telling people incorrect information for 20 years, and a lot of people have been hurt very badly from this. It is a very individualized, personal approach. There are some genetic factors that do significantly increase your risk of cancers. And certain cancers, tumors, can have receptors for estrogen on them, meaning it can make them grow faster, but that doesn't mean it causes the cancer. But we can accelerate the growth of certain things if we're not cautious, right? But again, 80% of cancer is caused by inflammation and micronutrient deficiencies and toxins and gut health. It's not just the genetics. So we have the advantage at Strategic looking at the whole picture, right? We can do genetics testing. We can look at your BRCA genes, your PABA genes, look at it for other syndromes that increase your risk. And if we decide in the very end that you're not a candidate for estrogen, we can do so many more things for you. What we just talked about, right? These are lifestyle things that you can do on your own to help your body produce its own hormones again and do them in a healthy way. There's even herbs. There's supplementation that are safe to use. So things like that have been on the market for centuries. Not market, but been available for centuries. Black cohosh and these kind of things. Vitamins, minerals, helping your body to make its own hormones again. So there's so many options for you. But no, I wouldn't take the fact that, yes, because somebody in my family had breast cancer at some point means I can't have estrogen replacement therapy. I don't believe that. Yes. Absolutely, yeah. Now, obviously, we want to do it at the same time, and most of our patients do. I do a lot. Like I would say, probably 80% of my clients are on hormone replacement therapy. I believe in them. And just to answer your question, and this is just my clinical evidence. I've been prescribing hormones for 10 years. 80% of my clients, and I've seen 2,400 of the clients. 2,400 clients in the past 6 to 10 years. If estrogen causes breast cancer, they should be my patients, right? I should be seeing a lot of cancer. I haven't. I have not had one client on hormone replacement therapy that's gotten breast cancer since I've been in practice. So there's something wrong with the system. We've been saying the wrong thing wrong, right? But I do believe that you want to do it in a healthy environment, as healthy as you can. So yes, work on the inflammation, do these other things too. But yes, a lot of times, estrogen gives you energy, right? Testosterone gives you energy. If you feel like crap, you're not going to want to change your diet. It's so easy just to go to Chick-fil-A and go to the drive-thru when you've got nothing to give, if you're pouring from an empty tank. So yes, if we can give you a little hormones to kind of boost you a little bit while we're working on the other stuff, yeah, let's do that. Absolutely. Yes. Bone loss. Were you asking what it was, what the diagnosis means?
Osteoporosis, you said that's more a risk for death in women?
Yeah. Than breast cancer, yeah. Because of the severity of it, we have treatments for breast cancer, right? So we have a pretty good survival rate of breast cancer these days. I don't know as far as like what's more common, breast cancer, osteoporosis. I don't know that. I would say in my practice, I would see a lot more osteoporosis than I see obviously breast cancer. But I don't know which one's more common. But I can tell you the outcomes are much less for people who fall and break a hip if they have osteoporosis. They're more at risk of dying than the women who have breast cancer. That's an alarming statistic, right? And why aren't we talking about it? Yeah. Yes. Sure.
So I'm 62, and I did not do hormone replacement therapy when I began menopause. Is it too late for me to do it?
That's a very individualized question. I love that question. I also teach other practitioners how to prescribe hormones. It comes up in every single mentorship question we have. The answer is we don't know. We do know there were some studies that show that the benefits that you're going to get for estrogen to protect the brain, the bone, everything we just talked about, that does need to be given within 10 years of menopause. Does that mean you can't have estrogen? No. It just means that you're not going to get likely the brain, the heart, the bone benefits from estrogen, but you can still get symptom reduction. So it's very individualized, yes. Now, I will be honest with you, if your body hasn't seen estrogen in 10, 15, 20 years, it probably is something else, right? Like if you've lived through the first 15, 20 years of having hot flashes and vaginal dryness and it's not that big of a deal and all of a sudden you feel like crap, it's probably something else, right? Your body's kind of adjusted to not having those hormones. So that's why we need to look at the adrenal glands or thyroid. So I'm not saying no. I do give, 10, 20. I've got 90-year-olds that have been on hormones for 30, 40 years. Yeah, and they're fantastic. They look like they're 50. But it's an individualized question. Yes, it's a good question. Anything else? Yeah.
So I had 2 pregnancies and 2 beautiful children.
Congratulations. Yeah.
13 months apart. I'm young, I'm only 32, so I'm not anywhere near menopause, but so would I benefit from doing some sort of, like, after having these pregnancies, like,
If you're symptomatic, you need to be tested. Absolutely.
I am overweight, so that's
Yeah.
a contributing factor, but I do have a lot of, like, fatigue,
Mm-hmm.
a lot of, like, weird gut issues.
Mm-hmm. Yeah. If you're having symptoms for more than 30 days, that's a chronic condition and it needs to be assessed. Yes. So we do, probably more than that, right? Probably more than for like years, right? So yes, test it and treat it, whatever's going on, absolutely. Or do you need hormone replacement therapy? I don't know. I don't give usually estrogen to women who are still menstruating because you're probably making some of your own. But I'm on progesterone. I've been on progesterone for 8 years, and it's life-changing for me. And it keeps I feel like it keeps my autoimmunity at bay, along with everything else I'm doing to keep myself healthy. But yes, I do believe in it, and I think that it's an individualized conversation. Now, mainstream GYNs, they don't love it. They don't really like messing with that kind of stuff. But that's okay. They got enough stuff to worry about. Like, if you've got a ovarian tumor or fibroid, please go get that taken out. Go see your GYN, right? Like, and everyone needs to. Everyone needs to have an annual screening with a gynecologist, have that conversation. But just know, if you get told no, that you're not a candidate, that doesn't mean that that's the only answer, right? So educate yourself. Seek out other means to get help. Yes.
What is your take on people who suffer from like extensive endometriosis, the recommendations being either hormone suppression prior to pregnancy, or if you're done having children, they want to do a hysterectomy. And if you choose to do neither, and endometriosis progresses and you lose ovarian function because of the disease process. So kind of stuck in a weird...
Yeah. So endometriosis is a very severe condition that takes years to diagnose, and it's missed a lot because it's hard to detect, right? It's a surgical intervention to be able to detect something like that. Endometriosis is multifactorial. It's an inflammatory process that's caused by bacteria that gets into the uterus. It's also a toxic issue, so there's toxins in the reproductive system, and there is some sort of leaky uterus component. I know that sounds weird, but there's a leaky gut and there's a leaky uterus. Your uterus lining is leaking. Cells outside of it is not supposed to be there. So it is a true functional medicine thing. And yes, I have been super successful with getting people to get back into remission. Endometriosis, unfortunately, like a lot of conditions that go undiagnosed and treated, can cause scar tissue. Arthritis is one of those things. And once it's already the scar tissue's there, it's hard to completely regenerate that, but I do think it's possible. It just takes more time. But if you put it in remission, oh, by the way, it's a hormonal issue too. So it's estrogen dominance. And that's why the medication works. But the medication basically puts you into menopause. That's what it shuts down everything. Yeah. But the root cause is like, why are you not getting rid of estrogens? It's a gut issue, right? So address the gut and then get progesterone to balance it out. Get that. You're missing the healthy, the child in the play box that's calming everything down. That's what you're missing. Yeah. It's super easy to treat, but it does need to be treated early rather than late stage. Thank you so much for coming. I appreciate that. I will be at the table for next little bit. I'm going to try to get to Boone and Blowing Rock to meet my family here in a little bit, so I won't be here long, but I'll be here tomorrow. You have another wonderful speaker, so I'm going to give her plenty of time. So thanks so much, everyone. Have a good day.